It's been a great passion of mine for some time, really, to think about looking after people with complex dementia at home. I'm working now in the same district as South London Healthcare, which is astoundingly out of kilter financially, and one of the districts is contracting £3.5 million for a month for unplanned emergency care, and its outturn is 5.5. So there's a £24 million overspend per year on unplanned emergency care. An awful lot of them have got dementia, and we know from Haringey that in the last 6 months of life, 80% of people who have dementia go through A&E. Home care, we know, is usually cheaper than the other alternatives. Acute hospital admissions we would not want if they were unnecessary, and long hospital admissions and delayed discharges, the biggest cause of that, of course, is dementia. So what we try to do is to have a service that will comprehensively assess people, plan ahead, and coordinate the care. The observation from all over the place is that when people have dementia, care is not brought together. The psychiatrist does a bit, the GP does a bit, the social worker does a bit, the OT does a bit, but they never really communicate, and there's no one who pulls that together. Our referral criteria are pretty simple, really, and based on a very simple hypothesis: anybody cared for at home with advanced dementia should have someone to support them, someone to coordinate that care. And yet, we know that very, very few people with advanced dementia at home actually have that. And someone in a focus group last week said, before you were involved, we got everything from everybody, but no one talked to each other, and after you were involved, it all came together and made so much more sense. So, home care and dementia till death is rare, poorly understood, and not funded. But we actually have done that, and we think we've saved a lot of money. Almost all people with advanced dementia would like to actually live and die at home if they could. If it's too much, of course the care home is the right place, and we want high quality care home inputs as well. But very few people actually choose A&E towards the end of life, and yet we know that's what they get. So managing distress, looking underneath distress for the key, having a conversation about what we're doing, all of those things put together. And we've looked after over 100 people. We've been very successful actually. In the last 3 or 4 years, 75% of all our people died at home without going to hospital, which is as good as a hospice actually, and we are proud of that. The tariff is astonishingly complex actually, but really an admission to acute care will cost a good £5,000. And so if you avoid an admission, you've saved that much money. And if you go into a care home, the PCT or the BSU will be funding the nursing component between £108 and £150 a week. And for social services, often there'll be social service funding. So if you avoid a care home by supporting someone at home, then actually you're avoiding significant costs. We think we've saved a good £2.5 million by doing better quality care. So, there you go. Quick summary of a service that we're proud of, that we think has had some really good outcomes, both in terms of supporting people at home and also, actually, interestingly, in turning out some really good value in a health economy that's spending money less well perhaps than it should.